All right. Good morning, everyone. I'd like to call the Committee of Health and Human Services to order on August 19th at 9:05 a.m. Clerk, please call the roll.
Legislator Kelly?
Here.
Newton? Here. Law?
Here.
Curtis?
Here.
Here. Okay. First order of business is to approve the minutes from the previous meeting. Are there any objections to the previous minutes or corrections? Seeing none, the minutes are approved. And first up, we have representation from McMahon Ryan, who are going to present today about the work that they do and their work with the county as well. If you both could just introduce yourselves and your title, we would appreciate that. And then it's going for you. Thank you.
Thank you. So I am Erin Bates. I'm the Executive Director at McMahon Ryan Child Advocacy Center since about 2025.
I am Allison Haar. I am the Deputy Director of Operations, and I've been with McMahon Ryan for about 11 years. The presentation you have in front of you today is really an overview of the services that we provide for children within Onondaga County that have experienced abuse or there are allegations of abuse. So starting off, I just want to give a general presentation about what it is that we offer, why we offer what we offer. So to start with, each county really has their own CAC. It's how it's set up. So for us, we are very lucky to have backing from the county to assist with operational costs to run the CAC. So if you're thinking about a child advocacy center overall, if you think back to like 20, 25 years ago, they weren't really in existence. And so overall, a child advocacy center was developed so that children that were experiencing abuse had one location to go to, and all of those systems and operations could happen within one building rather than going to different spots for that child to repeat themselves over and over, which we know is traumatic for a child experiencing this. Do you want me to wait for that to catch up? You're the best. Thank you. So that's our pretty building, 601 East Genesee. I had to figure out where I'm going here. Okay, so this is kind of visual to what I was just explaining to you. So before a CAC, you had individuals that were sharing their stories upwards of 15 to 20 times, depending on where they disclosed their abuse at. And now, if you have one location, you have a whole bunch of professionals that specialize in the investigation and serving of victims of abuse. And so it's obviously very much more trauma-informed, and it's considered best practice currently. I gotta get my stuff together. Okay. So if you're looking at the scope of the problem overall, on a national level, you have 1 in 10 children that will have been sexually abused by their 18th birthday. That's a national statistic. And then you also have 5 children that pass away each day as a result of abuse and or neglect. And then we know that 90% of child sexual abuse victims know their abuser, which you will see further on down the line that is accurate. And this statistic is a little outdated, but in 2025, it was a little bit more. We saw about 23,400 children in New York State with regards to sexual and severe physical abuse, neglect, and commercial sexual exploitation. On a county level, statistics are showing that 71% of the child victims we're serving are less than 12 years old. We had 96% of those child sexual abuse victims who knew their abuser, whether they were adults and or children or youthful offenders. In 2025, we served 1,803 children just in Onondaga County at McMahon Ryan alone. And we identified 142 cases of youth that were at risk of and or identified as being commercially sexually exploited. So when we're looking at perpetrators, we see a variety of things, as you can imagine, at McMahon Ryan. 1/3 of our cases do involve youth-on-youth offenses. Something to note there, though, is that even when there is a youthful offender that is identified in an allegation, we do not treat them as such. We essentially treat them as though something may have happened to them to cause that behavior and that acting out. And so we are still very careful about how we interact and interview those individuals who may have, quote unquote, offended on another child. There's no particular look or physical characteristics to a perpetrator. It's often somebody that has put in the time and energy to groom that child, someone that's known to that family or that child. So parents, caregivers, grandparents, relatives are all within the realm of possibility. Secrecy, threats, and manipulation are often a reason that a child may not disclose right away. So it is common for us to have cases that come to us at a length of time following when the initial perpetrator got involved with that child or the initial issue happened. Trying to make sure I go in the right direction. Like I was mentioning, this slide speaks to why children may not tell, and there's plenty of reasons as to why they may not, which is why we want to support them as best we can when they do come forward. So we have children who fear that they might not be believed. It's not uncommon for kiddos to tell somebody that this has occurred and then not be believed or have something not come to fruition in terms of like justice for that kiddo. They might have been sworn to secrecy, threatened by the alleged offender. We see that often. The relationship to the alleged offender, we can't sleep on that, right? So if you have family or individuals that are important to that child might not feel comfortable or want anything bad to happen to that individual, and sometimes that affects them coming forward to share what's happened. That child might feel that what's happened is their fault. We see plenty of that as well. So shame, guilt, being embarrassed about the abuse all play into that. And then lastly, but certainly not least, some children might not know that what happened to them is unsafe. And that could be from a lack of conversation about safety, a lack of conversation about relationships and boundaries. If we look at the research, so why is all of this important? It's because exposure to child abuse is actually linked to mental illness and depression and anxiety later on in life, impaired social emotional development, risky behaviors and delinquency, further trauma and abuse, PTSD, chronic disease, early death, all the awful things. And this is whether it's treated and or not. The outcomes are indeed better when there is an early response to a child that's disclosing abuse and getting them in treatment. Which brings me to the main purpose of a child advocacy center, right? So obviously all of these cases come to us through child protective or law enforcement when there is an allegation of abuse, but there are some other avenues for individuals to be referred to us. So we have child protective services and law enforcement all on site with us. So representation from the county CPS workers specific to the investigators that handle those abuse cases. We also have law enforcement representation from New York State Police, Syracuse Police, and the Onondaga County Sheriffs, all of which are Special Victims Bureau detectives. So that's the only type of case that they handle. We also have our CARE program, which is the medical component within our building, and that is the Child Abuse Referral and Exam program that is run through Upstate Golisano Children's Hospital. Every child that comes in, if there's an allegation of abuse, we offer them a head-to-toe physical exam. We have 2 nationally accredited doctors on site, and then Dr. Ann Botash, who's also nationally accredited in child abuse pediatrics, overseeing that program and working with those individuals that come to be medically evaluated. We have other community collaborating agencies that will make referrals to us or call and ask questions if they're unsure if something should be referred or if they should call CPS, et cetera. So we're trying to be a resource to the community that way. And then we also have self-referrals that will come to us as well. Parents that aren't sure, maybe their child disclosed to them, they're not sure what to do with that. So we do have a hotline during the day, and advocates will answer that. This is just reviewing the co-located agencies. So co-location is not standard for a CAC. The more rural you get, the less funding opportunities there are, and so they are not all co-located. I think we are, if I'm remembering correctly, I think we're one of 12 in New York State out of all the counties that are co-located. So we're very lucky to have that. We have law enforcement on site, CPS on site. The district attorney's office rotates, and as of September, we will have an ADA from the Special Victims Bureau on site with us day to day. Upstate Golisano Children's Hospital, their care clinic is on site, and then we have all the staff that McMahon Ryan employs. So our victim advocates, the anti-trafficking advocates, our mental health therapists, our child fatality review team coordinator, and then we also have an outreach and education team. Victim advocates are our peanut butter and jelly. They are one of the main things that we offer families when they come in. They are the first contact for a child and their non-offending caregiver when they come into the center. They provide support from start to finish. They are there to explain the process that they're going to experience, answer any questions that they have, and those advocates stay with those children and that family all the way through. If there's no disclosure, they can close that case rather quickly after doing a comprehensive evaluation of what that family may need. Because as you can imagine, even if there is no disclosure of abuse, it still affects the family unit, and they may need supports around that. If it goes to family court or criminal court, that advocate will follow them all the way through that process and beyond sentencing. So they are really the point person, the liaison for that family the entire time that they're involved with us and beyond.
Maybe can I interrupt you for a second? Do you
Yes.
have questions? I don't know if others have questions, but just along that line, when does your care end? Is there, after the courts, you had said sometimes they go after that, sometimes if there isn't.
So our protocol is to be about 3 months. We do follow up for roughly that amount of time before we close the case out. But I will say that it is also not uncommon for families or individuals, say they declined mental health or a physical exam when everything was happening. It's not uncommon for them to call back and say, okay, I think we need this now. Just because their case is closed doesn't mean that those services are cut off from them. Does that answer?
Yeah.
Okay.
No, that's
Yep.
pretty much the thing.
So about 3 months.
Anybody else have questions while we're paused for a second? Okay, go ahead.
You
Thank
can interrupt me at any point also. Very sorry. So a little bit about the interview process. We do something that's called a forensic interview. It's a very gentle interview. We make sure that it's a very child-focused and friendly environment, trauma-informed environment. These are pictures of the hallway leading to the forensic interview rooms, as well as one of the interview rooms. You will notice that there's comfortable furniture. Sometimes there are toys in them. We don't want to distract the child because we want to be able to have a conversation, but we want them to be comfortable from the second they walk in, going into this room. There is one individual that will be in that room with them. It's called a forensic interviewer. At our CAC, that's typically child protective or law enforcement. They are all specifically trained to conduct those interviews. After an interview, law enforcement and child protective will typically meet with the family and let them know next steps, as will an advocate to get releases signed and all of that good stuff. Next is our medical intake through care. Like I mentioned earlier, every single kiddo that comes in is offered this exam. All of those rooms look like a regular doctor's office, and it's a head-to-toe physical exam. It's not overly invasive unless it needs to be, and that's depending on the allegations of abuse that come in and the follow-up that the doctors are deeming necessary. Prior to the actual medical exam, there is a whole psychosocial emotional meeting that takes place with the non-offending caregiver and the care team to make sure, again, that this family is receiving comprehensive services for anything that they may be needing outside of just that medical exam. Mental health, this is relatively new to the Child Advocacy Center in terms of McMahon Ryan employing these therapists. It's about 2.5 years old at this point. We did have an MOU prior with Vera House, and thankfully, actually with help of county funding, we were able to finally take this on ourselves. So we have therapy provided on site. It's a trauma-informed service. We also are able to do family and group therapy if necessary. So we are a trauma-focused cognitive cognitive behavioral therapy modality, but we have therapists that are also able to provide EMDR and play therapy. So they are constantly evolving and learning different ways to take on and help clients in different ways.
Question.
Yes, ma'am.
Does the therapy, is that open to like the entire family or just the child, the affected person?
So typically it's the affected person. If there are other needs, we would refer those out. There are certain situations though where we have done family therapy, and that's just scenario specific. And the therapist, the clinical director actually makes that call whether that would be appropriate or not.
Do you have people trained in family therapy there as well?
So the one that would be conducting the family therapy, she's a licensed clinical social worker, but she's got an R license. So yes, she would be able to provide that. The next piece that I want to touch base on is our outreach and education staff. So this is very important that I share this with you because historically child advocacy centers are reactive. There are reports that are made and those reports come in and there's obviously an investigation that takes place. We were one of the first 2 child advocacy centers to be accredited for the optional standard of outreach and education because we have a licensed program that we're offering already to over 80 schools in the county. Within those 80 schools in 2025, we served over 23,000 unduplicated children. That number increases actually every single year because we're reaching more and more schools every year and providing more and more pieces of education. So High Five is our flagship program. That's the one that is licensed. And the important thing to know about that is that it actually meets the Aaron's Law mandate for students in grades K to 8 in New York State Public Schools receiving information about exploitation and abuse. It meets that mandate for free, and so we've already been doing this before this was passed, and that's part of the reason that we have such strong relationships within the schools. So much so that not only are we being called in to provide this High Five, but they're calling us in when the school is identifying needs. So we might have a school that's experiencing issues with like social media or sharing nude photos or bullying, and they'll contact our outreach team and request a specific presentation, and we'll be able to tailor that presentation to the need and present it to either staff and or students within that school. So our contact information is up here. I kind of alluded to it before. McMahon Ryan has been receiving funding from the county for many, many years. It's actually a significant portion of our operating budget. Our overall operating budget is about $3 million, and we are over $1 million in support from the county alone. And I'm going to be very blunt with all of you that without that funding, we would struggle. A lot of those funds are very flexible within our preventive budget with the county. It helps fill in gaps with salary. It helps with operating costs. Operating costs within our building take up a significant portion of our budget, and we're responsible for those. So I was speaking to all of those other entities within our same building. We're footing the bill for all of that. We are the overarching entity that maintains the building, the lease, all the things that go with that. And it's a building that's over 100 years old. So as you can imagine, it can be pretty expensive to maintain, but we take care of the entities that are with us. They have their own tech, IT, things that they have from their departments, but as far as building needs, we maintain those. And we're happy to do it because it makes working together easier, and it's best for the children. Best practice shows that being co-located and having everyone in one building is the way to go for ease of information, ease of access to everyone that's needed in that investigation, and to treat it appropriately. That's what I got.
Awesome. Thank you.
Yes.
Questions from legislators? Comments?
Well, I have comments and questions.
Yes.
Well, I've been doing this for a while, and this is the worst for me. I've been to your place, your center before, and it was very challenging for me. I can handle a lot of things. I cannot handle this item very well. What factors, as these cases continue to rise, I mean, why? Societal factors, what is your opinion. I have my opinion, but I'd like to know specifically what your opinion is on why is it continue.
So my opinion on that would be that it's always existed and we're just uncovering it more. I think it's become more openly accepted for children to come forward and share what's happening. Society as a whole is moving towards having a voice with children, right? And then all of the outreach work that we're doing, and the National Children's Alliance is seeing that outreach and prevention education is important, just as important as that reactive piece. Whereas I mentioned, like, child advocacy centers have always been reactive, that prevention work is just as imperative. And our outreach shows that. We're reaching over 20,000 students in a school year. We're in over 80 schools within the school, or within Onondaga County. And those numbers are directly related to those kids that we're reaching. We're all over the map within the county where we're providing that information and what to do if something is happening or you're concerned. And we're seeing that reflected in the numbers of kiddos that are disclosing. And those numbers are increasing because I personally feel that we're making it safe for them to do so.
I appreciate you and McMahon-Ryan Child Advocacy Center. It's always a challenge. Everything you do there.
Thank you.
You're special people. You really are. I couldn't do it. Not a lot of people could do it, and I appreciate everything that you do, and here to support you always, really. What about, so you answered it a little bit, what about this see something, say something type of thing that's out there that I haven't heard much about? You kind of alluded to that. You know, do these cases and what we're talking about, does this come out of neighbors, some family? Obviously, there's all kinds of people that could be the perpetrator. What's the normal way that this comes out or comes
As far as being identified to us?
Yeah, being identified to you.
It's a mixture.
Yeah.
And Ellie, you can speak to this if I'm wrong, but we have definitely, there's like a rainbow effect. Schools, mental health providers, neighbors, family members that are concerned. We've had parents that have actually called Child Protective on themselves because they're concerned about their own child and something that they may have witnessed. So it really runs the gamut. We get referrals from everywhere. Am I missing anyone that sticks out?
No, and I would just say we do have a hotline that runs during the day that the advocates on call do take those calls, and you know, those are parents, neighbors, school professionals that are calling with scenarios to see what they should do, and we're able to guide them and give them information and education and kind of help them through that process of what's happening and what the next steps are.
Last question is, and I believe I know the answer, but I want it from you, is this area specific? Is there a certain place where, if we had a heat map, where most of it comes from?
No.
Guys.
The only disparity that you might see if you had like a heat map, like you suggested, is barriers to access, right? So in your rural counties, you might have smaller numbers. That doesn't mean that it's happening less. It's just the access to the services itself. And again, like I mentioned earlier, when you're getting more rural, those services are usually not co-located like we are. So again, that's another level of, or another access barrier that you're encountering, because you have to have all those entities come to one location. So I don't think it's necessarily happening less all over. It's just depending on access to resources.
Thank you.
You're welcome.
Can I follow up on a couple of things before I go to other people? Is your coverage area just Onondaga County?
We are
each one?
specific to Onondaga County, yes.
Okay.
Yep.
And then there was a second piece about what you said that I'll have to come back to. Sorry. Anybody else with questions, comments? Elaine? Legislator Denton.
So you mentioned your budget is $3 million. I don't know where other sources are. I'm wondering, is there any concern for cuts or anything? I know with lots of different items coming up.
Yes. So we are, obviously, as a nonprofit, we have fundraisers that we do throughout the year, and we try to do a really great job with those. But a lot of our funding comes from grant funding, both state and federal funding that we currently have, and then we obviously have county funding. We have been on pins and needles with federal funding, waiting to see if that got pulled, if they were going to lessen it, because of course they can. We have been very lucky in that that contract has not been reduced at this point, but we are coming to the end of it. And as you all may or may not know, it's very difficult to get that federal funding for consecutive years, for consecutive award years. So I am a little concerned about our trafficking program, just because that is what our federal funds are funding right now. And we have 3 advocates that are affiliated with that, serving 150 kids at any given point. And that's also Onondaga County specific. But then you also might know about our New York State OVS funding, our Office of Victim Services. We have historically had funding through them, and as you may or may not know, they gave out awards for 2025 to 2028. That award was rescinded from us, as well as many other CACs and victim serving agencies, a month after the contract was supposed to start. And so we were left to scramble with that. They did do an extension, which we received, which was great, but we had to reapply for that Office of Victim Services funding, which we did receive for 2026 to 2028, but at a $160,000 loss for those 2 years. So I say all that to let you know that thankfully we did not have to let any staff go, so our program structure will remain the same, but we will not be able to expand, and we don't have any funds through that funding line now to give any of what we were giving before to identified victims, like rental assistance, locks for their home, hotel stays if they needed it, those kinds of things. Victim emergency service line is completely gone. The money that we have literally only covers salary. So we'll be a little bit more, we're gonna have to be a little bit more creative with how we come up with funds for the victims themselves.
To Legislator Burtis's point, this is tough, and with me doing the work that I do in preschool education and early intervention services, you know, you don't want to think about something like this. In an ideal world, we wouldn't need a child advocacy center and we wouldn't need to have this conversation, but what are the metrics that you look at in terms of, say, terminal outcomes for the kids that require your services? You'd like to think that once they get the services they need, once these things are addressed, it doesn't happen again, but I think that was probably not the case. So what do you see in terms of, you know, painting with a broad brush? This many cases go to prosecution, this many cases are, you know, taking kids out of an unsafe environment and finding better situations. If you know what I mean, take it. Go ahead, because I'm having a hard time describing it.
Do you have an answer for that, or are you okay if I? Painting with a broad brush. So part of something that I want to do moving forward is find a way to pull all the different systems information together, because as much as I would love to be able to answer that, I don't have a definitive.
Sure.
Because there's multiple data collection systems at play here. The district attorney uses their own system. Child Protective uses Connections, which we don't have access to. And then you have law enforcement that utilizes a couple different databases, and then medical is a whole nother cookie. So there's a lot of things when it comes to outcomes, it's very difficult for us to know.
Sure.
But what I will say is that in my experience, and I've been there for almost 13 years, prosecution could be better. As somebody that's been in this work for a long time, I understand that there are limits to what our legal system can do as far as punishment and things of that nature and types of charges that can be brought. But speaking from my own experience, and Ellie, you can add to this if you have something different, because you've also been there for a long time and seen plenty. I think that what we see overall is that we would probably wish for harsher punishment. All too often, we're seeing cases make their way through criminal court and not exactly have the outcome that a family might be hoping for.
Sure.
lesser charges or lesser time or no time served at all, maybe probation.
And I recognize that comes at a cost to the families and the victims as well of, do you want to put yourself through something like that? So, thank you.
Yeah.
Do you find that, it pains me to even ask the question, but do you see repeat instances with many individuals?
We definitely have them,
Yeah.
yes, unfortunately. Yeah,
Is that in both ends, as a victim and as a perpetrator?
correct.
Yeah.
Happen to know somebody who was on a grand jury with a situation, a very terrible situation, came in with 2 charges, accusations, left with 36. And this person I know very well was very, very bothered by the whole thing. And I guess that is very common, so much so that a regular citizen needs counseling as a result of just sitting on a grand jury. To your point, they went from upset and troubled to very mad about the outcome in the courts, not making sense of it at all. And so, it's very, very difficult. So that's to your point, right? From a person I know very well to be that troubled by what they saw, and I guess the rest of the jury was equally as troubled, then to not be able to make any sense of the quote-unquote punishment that person is probably going to receive. The point is, I don't think that, that these numbers are going to go down, right, to what you already know. But again, we just bump into it here. Most of us believe this is ugly, and we don't want to focus on it, look at it, but when it hits you right in the face, it is very upsetting, and then it really can get to you when you see the whole picture. So,
Yeah.
all the more accolades to you folks and for what you do continually, and you're a great part of the community, so very, very necessary, and appreciate it.
Well, I appreciate that because as somebody that we work in it every day, so I think sometimes we're a little jaded by what we're experiencing. And I was honored to be asked to come here today because I think it's important to know that we exist and that this is happening within our county and the scope of what that looks like, because so many individuals aren't even aware that we exist until something happens and they need us, which could be a good thing and a bad thing all in one, right? But hopefully with our prevention efforts, people will be aware of us and a little bit less taboo about us and having to come to us or reaching out to us for help. So this will help with that, and I appreciate the opportunity.
And we're all sitting here in full recognition that the work you do can be very challenging.
Mm-hmm.
The one thing that we've looked at within the county is supporting the folks that do the work. Are there efforts made on your part to make sure that people are getting the mental health supports they need, to make sure people are doing all right with the things that they see and they encounter on a daily basis?
Yes. So our leadership team is very focused on making sure that we acknowledge that this is very difficult work. There are built-in perks for all of our staff. They're actually doing a movie afternoon today so that they can have a break and watch a movie together and have some popcorn without having to worry about cases and what's going on. They get one work from home day a week because it is glorious to be able to sit in your pajamas until noon and just enter case notes until that time and not have that interaction that you would have in the office, the interruptions, the constant vicarious trauma that happens just by being present. And so there's plenty of perks like that are built in. We take good care of them, which actually leads me to, we have plenty of people that are actually hitting like 5 years and over. So our turnover is not terrible at all as far as staffing.
Legislator Denton, did you?
That was my question.
Yeah, I had that down too, so that's good. Legislator Black, are you good?
I'm good, yeah.
Okay.
Thank you.
I just have the one thing that I was trying to think about earlier. I know that when I came to visit you guys, you had talked about a mandated reporting piece that people just didn't know about. I don't know if it was like witnessing something. I don't know if you remember that conversation. But I'm just trying to think about instances where people should be reporting and just might not know that's a reportable instance. Are there gaps or, opportunities that you see? I'll word this differently because I can't remember our exact conversation. Are there gaps that you see that people should be considering when thinking about reporting, or what might be a reportable incident, even if you're not a mandated reporter, but somebody that just might see something?
Yes, so I always direct, or I used to when I would take hotline calls rather, direct individuals to OCFS's website with regards to reporting, especially now because some of the parameters around that have changed and what they will accept and what they will not. And so I direct people to that page. But also, if you're really unsure, it's okay for you to call, and they'll tell you whether or not they can accept it or not. And then I always tell people, if they don't accept it, call us and we can talk about other resources that there are, right? There's other options out there for anyone that might be concerned about a child or a family. And there's other ways to support that family as well, obviously, aside from calling in a report to law enforcement and child protective if they're unable to take that case for any reason. But on OCFS's website, there is a very well-structured, like a phone tree, if you will, that tells you if you should or should not call and make that report. So,
Okay, thank you.
you're welcome.
Everybody all set? Well, we appreciate you coming today and presenting to us and
guys.
talking
Thank you
about the work you
very
do.
much.
We appreciate everything you do too, like Legislator Burtis said. Thank you very much.
Appreciate it. Thank you all.
Good morning. The next item on our agenda is a presentation from Department of Children and Family Services. Amy, if you wouldn't mind introducing yourself in the microphone.
Good morning, Amy Cunningham, Commissioner of the Department of Children and Family Services, and I just want to say thank you to our friends at McMahon Ryan. Very great partners and lucky to have them working with us in the community. So it's good to be back here again. Today I'm going to talk to you about the Youth Bureau, which I believe is the last division that we haven't spoken about yet. And it was actually my first job within the department, was the director of the Youth Bureau many years ago. And now we have Erin Giacini, our Youth Bureau, among other things. She does all our staff development and training coordination. So the Youth Bureau is overseen by the Office of Children and Family Services, like Child Welfare, but it's a different division. It's the Division of Youth Development and Partnerships for Youth Success. So their goal is to support a system of quality youth development programming throughout the state, at the county, and there are also some cities that have municipal youth bureaus as well. We have what's called the Syracuse Onondaga County, so it's a combination. Within that structure, we have a youth board, which has members that are appointed by you. The legislature has one seat on it, the county executive, the mayor's office. There's law enforcement representation. There's towns and village representation as well. And then there is youth representation. So youth from the city of Syracuse as well as youth from outside the city within the county. And that group kind of guides the direction. We receive about $540,000 in youth development funding from the state. We use about 100 of that on internal administration, and then the rest we RFP for youth development programming. And that board does the allocation review. They talk about the priorities and what direction prior to the RFP going out every 3 years, where the funds, whether it's education, school attendance, whether it's sports, whether it's civic engagement, whether it's career readiness, they decide the direction of the programming for that funding cycle. We have, as I mentioned, Aaron, who oversees it. We also have a program coordinator that does site visits and oversees the actual programming. And then we have an RHY, Runaway and Homeless Youth project coordinator, and I'll talk a little bit about that in a minute. Some of the programs that receive youth development funding currently are Boys and Girls Club, Catholic Charities Refugee Youth Program. We give a little bit to CNY Jazz Youth Orchestra, Huntington After School Program, North Area Athletic Club, the boxing program, On Point for College. We fund Peace Big Brothers Big Sisters program. Camilla's Town Shop and Cicero Canteen are two of our suburban after-school youth centers that we fund. Whole Me, which is a deaf enrichment after-school program. And we also give a little bit of funding to its legacy funding from years ago when OCFS used to give towns and villages rec programs direct funding, and then it started coming through the counties. They're small amounts of money, but we've committed to continuing those funds. So every year, the towns and villages that have received that funding have the opportunity to say whether they would like it or not. And it funds stuff like chlorine for pools and lifeguarding staff or rec, supplies for rec programs. So the small bits is money, but really help for those smaller towns and villages. So that's generally the youth development funding. Within that, we also, a couple years ago, OCFS has started allocating youth sports funding with the mission of equal opportunity to sports program access for youth throughout the county. There are two different pots of money. One is called Youth Sports and Education, and one is called Youth Team Sports. The sports and education bucket is really trying to expand the definition of sports and looking at stuff like yoga and dance and hiking and sports that might not typically be available to all youth. So we really try to encourage programs to apply for those funds. And then the youth team sports funds, which, as it says, is for team sports. We receive about $300,000 for the sports and education and about $240,000 for the team sports. That RFP actually was just released for the next round of funding. And we are not sure how long the state is going to continue that funding. Hopefully it will be through the full 3-year cycle, but there's been rumors that they might be cutting those funds. But those have been great for some programs. YEOP, the youth basketball program within the city, Tilly's Touch Soccer gets that funding. So really supporting programs that don't have a lot of outside funds coming in to allow equal access to sports for kids. We also, some of those programs, we support Cornell Cooperative Extension Summer Camp, the sports component of that, Dunbar Leagues, we do RISE, the Refugee Youth Sports. We support Let Me Be Great, the tournament over the summer. And we support Building Men's Sports as well in the city school district with those funds. And then the last area we have is the Runaway and Homeless Youth programming. So we received just under $300,000 from OCFS for Runaway and Homeless Youth programming. A very small amount of that is put toward administration. The rest of it goes to Booth House, our Runaway Youth Shelter, and Barnabas Transitional Independent Living Program. So Booth House is a shelter short-term for 12 to 17-year-olds. It's a beautiful large house on South Salina Street. Youth self-refer there. They can show up there. The schools can refer them there. They can walk in the door any way they need to. Law enforcement will bring youth there sometimes. 211 refers youth to Booth House as well. It's generally a 30-day program. They can be those stays can be extended up to 120 days, and within that time, the staff there work to really find them, permanent, whether it's working with their families to get them home or finding, mostly getting them back home is the goal, to get to within those 120 days. Not many stayed that long. It is closer to the 30 days, and we average about 8 youth there at a time. Our Barnabas TILP is for older 16 to 22-year-olds, and that is a transitional independent living. They're apartments. They're 2-bedroom apartments. And that is where the old Booth House was, on Midland Road. Girls, males and females, can be part of the transitional independent living, and that is a 12-month stay that can be extended up to 18. And the goal of that is to find permanent housing and employment for those youth, or schooling, or whatever the next step is for them. They offer case management, living skills. When youth are in Booth House or Barnabas, they must be engaged in school or work. That's one of, the goals, that if they come into Booth House not engaged, they will get them engaged, but that is one of the goals, one of the requirements that they have to be working toward. Within the Youth Bureau framework and OCFS, actually, there's a very structured oversight process with report forms and site visits. And about 10 years ago, they pulled in the results-based accountability framework. And we here at the county and the Department of Children and Family Services thought that was a great framework to look at our population level outcomes as well as individual programs. And we have expanded that process to our whole department many years ago. But that within the Youth Bureau is where it started, where the program monitors first sat, and we have since expanded that team of program monitors to oversee our contracted agencies going on the site visits. So they visit once or twice a year. They meet with staff, they meet with participants, they talk to them and really evaluate the programs and then report back to the board. And that's kind of it in a nutshell.
Questions, comments? No? All right. Oh.
On the runaway housing and transitional housing, I imagine a large component of that would be some myriad of factors involving substance use, mental health, potential abuse as well. What do you see in terms of demographics coming in, and what services are available to help guide people through that?
Yeah, so the transitional independent living is, can be any of those situations. You
Sure.
said some sort of substance use, so substance use within the family, not necessarily the individual, but the individual wants to be out on their own independently. Some sort of separation from the family, neglect, abuse earlier in their lifetime, and now transitioning as an adult, really need that extra support outside of that unit. And Salvation Army is I should have mentioned, that agency that runs both of these and has an extensive array of services within the programs, but also outside the programs, that the individuals who are working through the Transition Independent Living Program can access. Case management, there are mental health services they can be referred to, substance use, and there's domestic violence services there if they are still working to maintain a relationship with the family where that may have been an obstacle or an issue, working through that. And then, employment and schooling, just making sure that they're on track to be successful adults. Mm-hmm.
Okay. Any questions from anyone? All right. Thank you. The other piece
All you have to present to us this year?
So the other piece that I had on here was the legal coming over to Children and Family. Can you just talk about what the status of staffing is in terms of recruitment, retention, or expansion, and what that might be?
So we currently have 6 full-time attorneys, a combination of contracted attorneys as well as county attorneys, and then 1 deputy chief who oversees that team, so 7 attorneys total. All of the parts in family court are covered. We are continuously recruiting to fill the county positions to be county employees so that we can move away from the contracted positions. We have a couple interviews set up. We have a couple more resumes coming in. We're doing recruitment at the law schools here in Syracuse, as well as Buffalo, Albany, across the state law schools. Trying to find some with family court programs. Not many of them have them. So encouraging, SU to maybe pick that up again. Looking at the internship and the externship programs at SU Law. We have a third-year law student possibly coming in the spring to do an externship. So really just engaging with the community more so to get the word out.
Great. Thank you.
If I remember, these positions fairly recently moved over from law, correct? Has that had the desired effect to bring them
Yes.
into the department?
Absolutely. They sit right on the 7th floor with our team. They prepare caseworkers, meet with caseworkers more regularly. I see them walking around the floor all the time now. That wasn't really the situation. We can engage with them, walk up and talk to them, whereas they were behind several locked doors before, and it was kind of difficult. But yes, it's been great. We have weekly meetings. Yep.
If we do get full staffing from the county employee perspective, do we foresee keeping some of those other contracts to help with capacity?
We would keep kind of like a per diem situation or short term, whether we needed somebody to fill in writing petitions now and then. But yes, we would absolutely keep at least one.
Okay, great. Any other questions on that? Well, I appreciate all of your presentations this year and helping us to be more informed about what you have going on. So we all care very much about all the work that your team does, so thank you.
Thank you. Thanks.
There's no other business on the agenda as long as committee members are all set. I'd like a motion to close the meeting.
Motion.
Okay, seconded by Legislator Burtis. All in favor? Aye. Any opposed? No. Motion carried. This meeting is adjourned at 9:56.